I am working to protect women and children from HIV.
I'm working to ensure that interventions for individuals, families, and communities are people-centered, acceptable, and most of all, respectful.
I'm working to promote the health and well-being of people around the world.
A lot of the work that ICAP is engaged in is tough and complicated, and it requires dedicated people who are astute and sensitive to the needs of the populations and sensitive to the needs of the government to get the work done effectively and successfully.
I'm inspired every day by all of the fantastic people who are within ICAP and by the global effort that we've been able to be part of within this fantastic organization.
And this anniversary, I think, is a time to mark the achievements of people working together, people working really hard, of commitment, of tenacity, of broad thinking, of thinking outside the box, and being fearless.
What I often hear wherever I go and wherever I talk to people in my travels is that they always say that ICAP can get things done, that when there's something difficult that needs to be accomplished, they call upon ICAP.
ICAP's success is found in its people who work for ICAP, who have a lot of experience doing global health in different contexts, in different countries, and in different areas of global health.
ICAP is making a difference in global health, having first-line leaders at all levels.
The ICAP approach is a combination of education and training, research, program implementation, impact assessments. So it's about transforming the theory and the knowledge to activities in the field and actions that really can make a change.
I have seen ICAP changing the lives of people living with HIV and the health systems that provide medical services to these people living with HIV.
ICAP has really changed the landscape of nursing and midwifery work in the country. More nurses and midwifery were trained, schools of nursing and midwifery were producing more nurses, and it has an impact also on the service delivery for maternal health.
We are seeing ICAP also now grow in terms of generating evidence, national surveys like the FIA project, implementation science studies, as well as clinical trials where we are now even testing new product investigation on new drugs in clinical research sites in Harlem, in Bronx, and in Eswatini. And ICAP is very strong at converting that evidence into public health programs.
So I think what ICAP does really well is working together to understand and assess the needs of a particular context, and then supporting the local and national government at all levels to build capacity and work together to expand and transform health services.
We are known to be a group that can innovate, that can do away with the barriers, that builds true meaningful partnerships. We engage with the ministries, we engage with the private sector, we engage with academic institutions, we engage with the civil society groups. That is really important, and it's because of the remarkable teams we have on the ground, both here in New York and around the world, people who are totally committed to our mission, who work day in, day out to be able to achieve everything that we're asked to achieve.
We're all in this together.
I am working to end HIV in Central America.
Working in the Philippines to keep the HIV epidemic under control.
Working to improve the health of communities in Central Asia.
Bringing services to vulnerable populations.
Working to build capacity in the African context.
Bringing transformative solutions for the patients that we work with.
Listening to what they want. Changing the health system to feed into what they want. What makes them happy, what makes their lives better. What keeps them on treatment for the rest of their lives.
I am ICAP.
I am ICAP.
I am ICAP.
I am ICAP. I'm Global Health.
I'm ICAP. I'm Global Health.
I am ICAP. I am Global Health.
Global Health.
Eu sou ICAP, eu sou Saúde Global.
Nós somos ICAP, nós somos Saúde Global. We are ICAP, we are Global Health.
We are Global Health.